Our topic today is double and doubling in psychodrama and in life. And we are here in Button Place at Original Moreno Stage at Hudson Valley Psychodrama Institute with Deb Shaddy. Hello, Deb.
Hi, Anna. It's great to be here with you.
It feels very nice here.
Good. A double as an auxiliary really helps the protagonist maybe to know something more about their inner experience or to feel free enough to express it that they aren't able to do otherwise. Sometimes we don't even know ourselves that's what we're feeling until we hear somebody else say, oh, maybe you're feeling angry at your mother. Well, then we can take that in and go, oh, maybe you're right. Maybe I am feeling angry about that.
I am angry, I'm tired, and I have some resistance. I don't want to do that.
Right.
I feel anxious because I'm here first time at my first session with you, Anna.
I'm feeling very anxious because I'm here for the first time.
I'm angry. Regarding our topic, could you please say what is double and doubling and what is it used for?
Well, doubling and being a double comes out of a psychodrama auxiliary role. So there are a number of roles that people take on in service to the protagonist to help the protagonist tell a story or explore some aspect of their life. So this particular role is helpful in helping the protagonist to expand something that they're feeling or to help them identify some things that they might be feeling that maybe they're not fully conscious of. What the new brain research is showing that when we have good enough mothering, mothers are able to exchange affective and feeling information right brain to right brain with their babies. Right. So a mother is able to tune into the baby's body language, the type of cry, and to know whether the baby's hungry or tired or lonely or overstimulated or bored, and then to be able to, first of all, provide for that need, take care of whatever it is the baby needs, but also the mother is then able to begin to translate the baby's sort of unformed, felt experience into language. So it helps the baby to begin to translate their own feeling into language. So doubling in psychodrama really comes out of, it's an extension of that process, so that a double as an auxiliary really helps the protagonist maybe to know something more about their inner experience or to feel free enough to express it that they aren't able to do otherwise.
What would you say that the main goal of doubling?
Well, I think to know themselves better and to be known is probably sort of the shorthand version. But the main goal is to help the protagonist express feelings maybe that haven't been expressed yet, to maybe feel free to express feelings that sometimes we have feelings that feel unacceptable to us, such as anger, rage, jealousy, some feelings that maybe we've either identified ourselves we're not supposed to talk about, or society tells us it's not okay to have these feelings. And so it helps the protagonist to feel free enough to express those feelings. It can also...
Like I would say, how I hear this is like having access to that feelings, right?
Right. Well, it's having access. It's also having the freedom to express them. And sometimes we don't even know ourselves that's what we're feeling until we hear somebody else say, oh, maybe you're feeling angry at your mother. Well, then we can take that in and go, oh, maybe you're right. Maybe I am feeling angry about that. Or maybe I'm feeling hopeless and I didn't know I was feeling hopeless.
Could you please say briefly about doubling yourself?
Sure. Another great way to use doubling in psychodrama and in individual therapy is a technique called doubling yourself. So I believe we all have layers of truth inside of us. Some of these layers we know are there but don't feel free to express, and some we may not even know are there. It's a great experience for people to stand up and maybe move behind their chair. Do you want to try that?
Yeah, let's do that.
So, Anna, is there a little issue in your life that you've got some feeling about?
Yeah, we have here the 6 days of training. I've been recently, and tomorrow starts new training again. And we were talking about that. When I was returning back, I had 1 day off, and I'm returning back, and I had this feeling that probably I don't want to return.
There's more to come.
Yeah.
Okay. So, Anna, why don't you stand up and stand behind your chair and tune into, are there any other feelings that you feel right now?
I am angry, I'm tired, and I have some resistance. I don't want to do that.
Right. So just for the experience, why don't you take one step further into yourself, behind yourself. So you're doubling yourself at another level and see if there's anything else there.
Wow. It's unbelievable that, again, even in demo, I feel that. So here is, I feel very peaceful. Relax.
So tune into your body, and where are you feeling that in your body?
Right here.
Okay. All right, so come in, and now that you're sitting in this chair, what do you want to bring forward and bring here from that doubling experience?
I like them both.
Mm-hmm.
I would like to have them. I would like to maybe change their places. I would like that second one come here.
Okay. Well, can you bring any of that forward into where you're sitting right now?
Yes.
Okay.
I can feel that.
So make a final statement from those two doubling experiences for how you're feeling right now.
I will survive.
It'll be hard, but I
yes,
will
survive.
I will survive. Okay, good.
Wow, thank you. In which situations you see, just maybe some examples or practical situations where doubling or double or both would be useful?
So in a psychodrama, members of the group or the audience are feeling like there's something going on in the protagonist that's not being expressed. Mm-hmm. Or not being fully expressed. Mm-hmm. That's a time in the psychodrama when someone might come up and offer to be a double. I can give you a couple of other examples from both a therapy setting and from a personal life that might also show you how it can be helpful in all areas of our life. In a therapy setting, I was working with someone who was struggling a lot with her relationship with a child. Her own child. Mm-hmm. And the situation was that the parents were divorced and things were a little bit, they were a lot challenging with the child's father. And it was really hard to kind of get to what was going on, what was making it so hard for this woman to connect with her child. Uh-huh. And at some point I was able to kind of get the sense that it was hard for this person to forgive her child for having this man as his father. Mm-hmm. And once I was able to identify that and offer that to the client as a potential thing she might be feeling, that sort of broke a log jam. And so that's an example of how in a therapeutic situation, when the therapist is able to pick up something that maybe the client's not expressing, and maybe not even totally aware of, or certainly might not feel free to say, that can open up areas for exploration.
Well, that's a great example. How does it work in individual setting and in group setting? Maybe there are some differences or just some ideas about.
Well, in an individual setting, of course, you're there with an individual client.
Right.
So the therapist can say to the client, I want to offer something that I think you might be feeling. So the therapist then gets up and moves into what we would call the doubling position in a psychodrama. So you're sitting next to the client and a little bit back from them, and you're speaking as if you're an inner voice for the client. So you're saying, I'm feeling really sad now, or I'm feeling really hopeless. And it takes you out of the therapist role. So you're not interpreting in the way you might if you were sitting across from a client, but you're moving into what we would call a doubling role.
I usually offer as to be, would you like me to try to express your inner voice?
That's a great way to say it. Yeah. I think saying I'm the inner voice, or can I try something as an inner voice for you, is a great way to say it, because it helps the client to put it into a different perspective. And it's also, I think, important to let the client know that they're free to accept it or reject it. And I always say to the client, if this doesn't fit for you, throw it away or change it into a way that it does is true for you.
It would be wonderful if you give an example from your personal life.
Well, I do have one actually. A couple of summers ago, I was taking care of my great niece, actually, who was about 7 months old at the time. And before her mother left, she gave me instructions on how the baby liked to be put to sleep. She liked to be jostled a little bit, and the mom kind of gave me all the instructions on how to do it properly. So I tried that, and it just didn't work. So I was trying to sort of get inside, the baby in a sense, to figure out what was going on. And I realized, my body's totally different than her mother's, everything's totally different. And I said, it must be so hard, you just can't get comfortable. I just can't find a way to get comfortable, and as soon as I said that, the baby just sort of relaxed. And it's like I got it. I got what the problem was. I couldn't fix it because I couldn't make it better. But somehow just being gotten, I think, really helped her to relax in that moment.
Right. And when you are telling me this story, it's just my idea. It probably helped you
relax as well. That's right.
Wow, that's a great story. Could you please say a little bit more about what kinds of doubling there are, or what kinds of doubling you use at your practice or at HVPI when you teach?
Sure. Probably the one that's the simplest to learn and the one that's the easiest for people to remember is what we would call the supportive double. So it's someone who's coming up onto the stage or in working with a client to be able to just tune into all of the feelings that that the client or the protagonist might be feeling. That's clearly a simple one. Anna, this is an opportunity for you to practice doubling with a client. So a couple of things that are kind of important to remember is, one, to tune in to the feelings, the body language that your client is expressing, and tune into maybe anything that's important that you feel is not being expressed. Okay? And when you feel you have that in mind, how will you introduce that you're going to be doubling?
Sanaya, would it be all right if I would try to be your inner voice?
Fine.
Fine?
Okay. And how will you do that? How will you do that from your chair? Or
I will stand and go around and get behind and put my hand on the shoulder. Is it all right to touch you?
Yes.
Okay. Sorry,
Okay.
I should ask it prior touching. And
Okay.
then
And you will
Yes.
speak using I because
Yes.
you're the inner voice.
I feel anxious because I'm here first time at my first session with you, Anna. If it feels right for you, please repeat. If it doesn't, do I do everything right?
Absolutely.
If it doesn't feel right, please correct me.
Okay. I'm feeling very anxious because I'm here for the first time.
I'm angry.
Yeah.
Let's let her have an opportunity to express some things first. The other thing that's important is to double when it feels appropriate,
Right.
you know, and maybe to not let it have a page full of text before you double. Okay, does that make sense? That-
So we need to know the story.
Exactly.
Uh-huh.
Exactly.
Uh-huh.
Okay.
Try one more time.
Yes.
Could you please tell what brought you here today?
I came here because recently I feel like I don't have energy.
You don't have energy.
No. And every morning when I woke up, I don't want to go out or do something new, or I don't have energy.
Uh-huh. Would it be all right for me to try again to be your inner voice? Something is sucking energy from me. And I don't know what it is.
Yes. I don't know why, but something's sucking my energy.
And I'm here to figure out what is that.
Yes.
And I hope you, Anna, will help me with that.
Yes, that's why I came here.
Uh-huh. And now I feel excited that I was able to verbalize that.
Yes, now I feel so excited and somehow I'm feeling safe.
Uh-huh.
So Anna, come back here and sit down.
Am I a good student?
You're a very good student.
No.
So I'm going to let you have an opportunity to try doubling it wrong, so that it doesn't fit for Sinai, and we'll see how that works out.
All
Okay.
right. Is it all right if I will be your inner voice again?
Yes.
Uh-huh. Is this a paradoxical double?
Well, it can be, or it can be you're just not getting it quite
Okay.
right.
Okay. And let's see. Uh-huh. Beautiful.
So Sinai can tell a little bit more of the story, and you can double from there.
I would like to tell you the story.
Yes. I'd like to tell you a story about me, and yeah, I'm feeling I don't have energy. Maybe because
And I feel really happy about that. I'm very happy about that.
no, I'm not happy. I'm not happy.
Even though I don't have energy, I wake up every morning and enjoying the day, and I like everything what's happening around me.
No.
No. Okay. So come back around. Okay. So sometimes when we don't get it right, it helps to clarify for the protagonist what is right. And she did kind of already express that this was really hard for her. And it helped her to feel safe when you got it right. would it be okay if I tried to be an inner voice?
Mm-hmm.
I'm kind of worried that I might be sick. If that's right, put it in your own voice.
Yes, I'm worrying a lot.
Mm-hmm.
About being sick.
Mm-hmm.
Yeah.
Mm-hmm.
It's always important when we double that the client or the protagonist repeat it in their own voice so that they own what's being said. Or if it's not right, that they throw it away and make what is true
Mm-hmm.
a statement.
Mm-hmm.